Hi everyone. Today we will discuss about the most important topic for psychiatric schizophrenia. What is the definition of the schizophrenia? Schizophrenia is a chronic severe mental disorder characterized by the disorganized thinking, disturbed perception, abnormal behavior and loss of contact with the reality. We can say that when the person loses all the contact or the behavior abnormally and they are disturbed in the thinking, it's also known as the schizophrenia. What are the main causes of the schizophrenia? We can say that there are some main causes of the schizophrenia. We can describe biological factors. Dopamine imbalance. When the dopamine will increase, then it will see the positive symptoms. Abnormal levels of serotonin, glutamate. Structural brain changes like enlarged ventricles. Then genetic factors. Strong genetic links. 1% general population, 10% in first degree relatives, up to 50% in the identical twins. Neurodevelopment factors. What are the neural development factors for the schizophrenia? Fetal exposure to viruses, hypoxia, lack of oxygen in the tissue. Hypoxia means maternal malnutrition. When the mother can't get the proper nutrition, it is known as the maternal malnutrition. Fetal exposure to the virus. When the fetal get affected through the virus, this is known as the fetal exposure. Psychosocial factors like stressful life events, like daily routines, like when you are going to the office daily, you are getting scolded by your boss, stressful life, and fighting with your wife daily or some other people. This is known as the stressful lives or stressful event. Dysfunctional family relationships, we already says that's husband wife fighting or anything. Double bind theory. Environmental factors like urban upbringing, substance use like cannabis, LSD. There are so many theories of schizophrenia. First, dopamine hypothesis. Increase the dopamine in mesolimbic areas causes psychosis. Glutamate hypothesis. Decrease the glutamate activity causes the cognitive or negative symptoms. Serotonin theory. When the serotonin increase, that linked to the hallucination. Then neurodevelopment theory. Abnormal brain development in utero. Genetic theory. Strong familial inheritance. Psychodynamic theory. Regression to pre-ego stage. Then double bind theory. Conflicting parental message. Stress vulnerability model, genetic vulnerability plus environmental stress. Types of schizophrenia. Traditional subtypes now removed in DSM-5 but still asked in the exam. There are the type: paranoid, delusion and hallucination, relatively preserved speech. Disorganization, habiphrenic. Disorganization means when the speech, behavior, flat, inappropriate effects. Just a normal person can talk, how are you? But the schizophrenia affected person cannot ask like that, how are you? They will stop, they will ask something. They wanted to ask like, how are you? But they can't ask. This is known as the disorganized speech. Or they will ask, but in the rude behavior, how are you? Like that only. Catatonic, motor immobility, stupor, oxy flexibility and echolalia. like undifferentiated symptoms don't fit into the one category. When we can't find the exact reasons, that time we are giving the undifferentiated. Like sometimes they will sit like a catatonic posture, sometimes they will behavior like stupor, oxyflexibility, and sometimes they are more aggressive. That time we can't decided which category they are. That time we are giving in the undifferentiated. Residual past episode with the persistent negative symptoms, like example we can give that a person loved a girl but girls already did the suicides. That persistent negative symptoms come from that. Sign and symptoms. What are the sign and symptoms for the schizophrenia? Positive symptom, excess behavior. They will talk more, they will give more expression or more friendly to you, or they will ruding behavior to you. This is known as the positive. Delusion means false fixed beliefs. When the patient will say, like schizophrenia patient will say, in this rice there is a poison, but if you are telling that there is no poison in the rice, they will not believe you. They will stick their decision like in the rice there is a poison. They will think like that. Hallucination, mostly auditory hallucination. Hallucination means what? When the schizophrenia person will hear something but in the reality there is nothing. This is known as the hallucination. Mostly auditory hallucination, they will hear something but in the reality there is no sound around them. This is known as the hallucination. Disorganized speech or the thought. They will try to speech a sentence or complete a sentence, but they can't. They will think, they will make a sentence in their mind, but they can't also make the sentence in their mind. Like I live in India, they will thought I India, I live, but they can't complete the sentence. This is known as the disorganized speech or the thoughts. Busier behavior, they will show that they are too much busy. Negative symptoms, loss of normal function, evaluation, lack of motivation. When the person will be suffering from the schizophrenia, when they will get the negative symptoms, they will show the lack of motivation. If so many works are pending, works are pending, but they will not do anything. They will simply lie or simply sitting in the chair or the bed, something. Allogia, poverty of the speech. They can't speak the properly and they will not tell something. They will totally be silent or will not behave like a normal people. Anhedonia means inability to feel the pleasure. When the person will not feel the pleasure, this is called as the anhedonia. Then affective flattening, lack of emotion express. Like when you see the schizophrenia patients, if somebody in the relatives they got died in front of them, they will not show any emotion towards them. They will not show the crying, they will not show the expressions of the kindness or crying, they are sad, anything they will not show. This is known as the lack of emotion. Social withdrawal, they will withdraw them from socially. They will separate from their society, or they will sit or they will sleep in a one room. They will not contact with the others people. This is known as the social withdrawal. Cognitive symptoms, poor attention. They can't attend is like a good or pro. Memory problems, they can't remember so many things in the past happens, or Sometimes they forgot the day before yesterday things also. Poor executive functions. Diagnosis. Based on the DSM-5 criteria, less greater than 2 of the following symptoms for greater than 1 month: delusions, hallucination, disorganized speech, disorganized catatonic behavior, negative symptoms. Continuous signs for 6 months if they will see the 6 months. Then treatment. Pharmacological treatment. Typically antipsychotic first generation drugs we are giving to the schizophrenia patients like haloperidol, chlorpromazine. Side effects. What are the side effects of the haloperidol and the chlorpromazine? EPS, tardive dyskinesia. Then atypically antipsychotics second generation: clozapine, olanzapine, risperidone, aripiprazole, fever, EPS more effective for negative symptoms. Clozapine reversed for resistant schizophrenia. Closely monitor WBC count regularly. Risks of agranulocytosis. Psychosis therapy, CBT, cognitive behavioral therapy, family therapy. We have to tell the family how to cooperate with the patients and how to behave good to the patients. Social skill training. Sometimes we have to give the socially skill training like how to behave with the people, communicate among them, and don't stay alone in the rooms. Like some activity like playing football, playing cricket, or playing in the ground, something. Rehabilitation. If is in the last stage, we have to give the rehabilitation. ECT, electroconvulsive therapy, used in the catatonic or treatment resistant schizophrenia. Nursing responsibilities. Assessment. Assess for the hallucination, delusion, suicide risks. If there is in the ward, we have to closely monitor for the suicidal risks. Observe behavioral changes. Monitor drug side effects. Environment. Provide low stimulus, safe environment. Ensure safety, especially with the paranoid or catatonic types. Reduce environmental stress. Communication. Use clear, simple, or non-threatening language. Avoid arguing with the delusion. Don't reinforce hallucination. Example: I understand you see something, but I do not. Don't argue with them. Don't deny with anything. Medication. Administer antipsychotic as prescribed. Watch for the extrapyramidal symptoms, EPS, and the neuroleptic malignant syndrome. Encourage compliance, family education. Explain the illness nature, importance of medication adherence, early relapse signs, therapeutic relationship. Build trust among with the patients. Provide empathy and support. Encourage self-care activities. Encourage for the self-care activities is the most important things to improve the patient condition, Important nursing exam points. First rank symptom, Sendiers, is thought insertions, withdrawal, broadcasting. Most common hallucination is auditory hallucination for the schizophrenia. First line treatment, atypical antipsychotics. Drug causing agranulocytosis is clozapine. Delusion of persecution, believes that one is being plotted against. Worksheet flexibility seen in the catatonic schizophrenia. Thank you everyone. Please like, share and subscribe.